Hey, 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 how you doing? This is Bill Santos, and today is December 10th, 2023, and I just had the urge to make yet another video for my YouTube channel to give you kind of an update on my medical condition. I'll try to keep it as brief as I can. And at the end, I'm going to do a quick product review. A new product has arrived. At least it says new on the front of the package there. So anyway, I'm still laid up here in bed. Following 2 spinal surgeries this year, fairly recently. I had a surgery on September 2nd, if I think about that, where I had an infection, an abscess in one of the discs in my lower spine. Basically what happened was I went after the surgery, a few weeks after, or several weeks after, I went to my surgeon's office in a transport chair, wheelchair, and I was in such great pain that the physician's assistant told me to go to the hospital emergency room. There I had some tests done, I guess x-rays and CT scan, I guess it was, or whatever. And it was determined that I needed immediate spinal surgery, another surgery, but this one was much more involved. Turned out that I had, and maybe still have, I'm not sure, something called osteomyelitis, which is a bone infection, and the infection was so bad that the surgeon told me that my spine was collapsing and I needed immediate surgery. So I scheduled me for surgery for 8 a.m. the next day. It was a 6-hour surgery, and I had a titanium rod screwed into my spine. Had about a 14-inch, between 13 and 14-inch long incision in my back, and I put the titanium rod and screwed it in, so I'm all stabilized. I'm also using this electronic device with 2 electrodes that stimulates my bone growth. So I'm been doing that, and I'm not doing anything. I just kind of hook it up and just does what it does. I have a home nurse. The incision is basically healed, although I'm dealing with kind of a small hole in my back that did go like about a week or 2 all the way through to my spine, but it's closing up, and the nurse says it looks good. She changes the bandage every other day, so today's Sunday, so she'll be here. She was here yesterday, and she'll be here tomorrow. I'm also engaging in physical therapy. Still confused about that because physical therapy is from the waist down, and occupational therapy is from the waist up, but I have an occupational therapist coming to our home here, helping me with physical therapy. So, because basically you can see I'm doing okay. My upper body, my legs, another story. I can't even stand up without support from my wife or the transport chair, which is a wheelchair, or walker. I can't even walk. I can't even stand at this point. I've been doing leg exercises in bed with her supervision. She comes Wednesdays and Fridays, and then I just do the exercises on my own on the other days. And then this coming Wednesday, the plan is for me to sit in some kind of chair and do chair exercises, and hopefully my legs will get stronger, and I'll be able to eventually walk with a walker, and then walk without a walker, and then I can live again. Start taking walks outside. I wasn't going to get into this, but the pain in the hospital and at the rehab facility, physical rehab facility, the pain was so great that I was on opioid medication, hydrocodone, oxycodone, and I had a fentanyl patch. I haven't taken any of that crap in about 2 weeks, but I'm still really trying to endure and get through really severe withdrawal symptoms. I'm doing pretty good now, but basically the problem is really intense muscle aches and convulsions. But as you can see, I'm okay for now. It gets worse at night. That's about it. Actually, I would like to mention that I was on intravenous antibiotics every day for 13 weeks. I started with a 6-week regimen for blood infection and possible osteomyelitis, bone infection in one of 2 fractures in my ankle. Then I had to deal with the osteomyelitis, bone infection in my spine. So that was after 5 weeks. After 5 weeks, 1 week short of the regimen, I was put on another 6 weeks. So that was 11 weeks. And then my infectious disease doctor said I needed 2 more weeks. I'm still waiting for the test results of the swab test that I took last week. I think it was last week, yeah. And if it's still infected, then I'm going to need 2, 4, or 6 more weeks. But my home nurse said that it looks good and it's healing, and maybe I'll be okay. So I can see I got the PICC line there, so that's still in. If I don't have to have any more of the antibiotic, then my infectious disease doctor will give the okay for my nurse to rip out the line. I think it's about that one. I don't know. Anyway, that's about it. I'm actually feeling pretty good right now. Maybe I'm getting back to my old self. I don't know what's going on with this phone. I hope it's still recording, and if it's not, then it's a product. It's Nutella Biscuits, made in Italy. So I was just going to see if I could open it and taste one and tell you how it is. So, okay, let's make one little mess. Alright. Alright. That's cool. Smells wonderful. They're looking decidedly smaller than I expected. Just like that. Yeah, they're a little smaller than on the front side of this package. So, Hmm. Tastes like you'd expect. They call it a crunchy golden baked cookie, but it's kind of like a shortbread cookie with Nutella. So it's quite good. I'm quite fond of Nutella, even though I haven't had it in a long time. Hmm. Yes. Yep, they are made in Italy. They are quite good. And it does have the resealable plastic strip in here. And there you go. That's all. I hope you enjoyed the video. I hope it wasn't too much of a sob story, but I am still struggling, but I'm a lot better than I was. I was like so much pain, you wouldn't believe. Like right now, I'm just on kind of intermittent acetaminophen, like Tylenol, and that's really all I've been needing. I do get cramps. It's not even, I don't know if you call it cramps, it's just really where my whole body aches, but it's mostly in the legs. And I do have neuropathy in my feet, which is like a pain and numbness. And the muscle aches make my feet hurt even more, and then it's worse at night, and some nights I'm just lying here in agony, keeping my wife awake, which I'll apologize here now. But some nights are good. You know, it's muscle aches, the tremors. Sometimes I get tremors like for an hour, and I can't stop jerking like that. And then they kind of stop. Another withdrawal or side effect of withdrawal is insomnia. So I haven't really slept in probably 2 to 3 days, maybe 3 days. I'm just awake, you know. Anxiety is another symptom. But I had 3 surgeries last year. I had a quadruple coronary artery bypass surgery, I think that's what it's called, in March of last year, and then I had 2 reconstructive, basically 2 reconstructive chest surgeries in May, and I was on, you know, some opiates at that time, and I went through the same thing, same withdrawal, but it was only like a week or week and a half, and I think I'm just about maybe at 2 or 2.5 weeks now, and hopefully I'm coming to the end of it, you know, because I had enough, you know. Okay, that's enough. I've taken enough of your time, and I really appreciate you watching, and thanks for your support and your prayers, and I hope I was basically coherent, because I'm kind of like heavily medicated in different areas in my head. It's still kind of a little fuzzy, foggy, and I'm trying to put words, sentences together, and I hope I was successful. Thanks again for your time. Bye for now.